Welcome back to our psychology series for BSc Nursing. In the last video, we have discussed basic concepts and applications of principle in psychology. Today, we will explore an important topic on the different branches of psychology. Psychology is a very vast subject, and over time, it has developed into several branches to study human behavior from different perspectives. As a nursing student, understanding these branches will help you to apply psychology more effectively in patient care and professional practice. साइकोलॉजी पिछले सालों में एक बहुत ही बड़े विशाल बर्गर की तरह फैला है। इसकी ब्रांचेस इतनी सारी हैं जो आज हम पढ़ने जा रहे हैं। तो हम स्टार्ट करते हैं। Just like a tree, it has many branches. Psychology also has many specialized fields. Each branch study human mind and behavior in a different way and on a different purpose. Let's now discuss these branches. तो सबसे पहली ब्रांच आती है जनरल साइकोलॉजी। ये एक फाउंडेशन ब्रांच है। इट स्टडीज बेसिक मेंटल प्रोसेसेस जो हमने कॉन्सेप्ट्स में भी पढ़े थे, लाइक लर्निंग, मेमोरी, परसेप्शन, इमोशंस, मोटिवेशन, एटसेट्रा. Understanding how memory works help a nurse reminding patients about their medication schedule, etc. अगली इंपॉर्टेंट ब्रांच साइकोलॉजी की है डेवलपमेंटल साइकोलॉजी, विच मेनली फोकस ऑन ग्रोथ एंड डेवलपमेंट अक्रॉस द लाइफ स्पैन. मतलब 25 बचपन से लेकर जेरियाट्रिक केयर तक जो साइकोलॉजी की फील्ड हम यूज़ करते हैं फॉर studying human behavior and mental processes includes the developmental psychology. For example, nurses use development psychology to understand the needs of premature baby versus an elderly patient. The next branch is social psychology, which studies how individuals behave in a group and how society influences the behavior. For example, a patient's recovery is often faster when they get family and social support. Another branch is clinical psychology, which mainly deal with diagnosis and treatment of mental, emotional, and behavior disorder, which you will study in psychiatry or mental health nursing. For example, a clinical psychologist may help the patient dealing with depression after surgery. Nurses need to coordinate with them for holistic care. Another branch is counseling psychology, which focus on everyday problem like stress, adjustment, and relationship. For example, a counseling psychologist may guide a cancer patient in coping with the anxiety during treatment. Another branch in psychology is educational psychology, which study how people learn and how teaching can be made more effective. That is educational psychology. Nurses in training benefit from learning strategies and motivation technique, which is explained by educational psychology. Another branch of psychology is industrial and or organizational psychology. It applies psychology principle at the workplace to improve productivity, motivation, and teamwork. For example, in hospital or in an organization, this branch help to improve nurse-doctor, manager-employee relationship and reduce workplace stress. Another branch of psychology is health psychology, which study how biological, psychological, and social factor affects health and illness. For example, nurse apply health psychology when teaching patients about lifestyle changes, diet, and stress management. Another important branch of psychology is abnormal psychology, which mainly focus on abnormal pattern of thoughts and behavior. For example, anxiety, phobia, schizophrenia. These are some mental illnesses. Nurses in psychiatric ward must understand abnormal psychology to care for mentally ill patients. Another important branch of psychology is experimental psychology, which uses experiments to study processes, कौन से processes, sensation, perception, learning, thinking, etc. Research on sleep and memory help nurses to understand how lack of sleep affect patient recovery. So, physiological or biological psychology, which study the relationship between brain, nervous system, hormones, and behavior. For example, understanding how neurotransmitter affect mood is essential in handling patient with depression. So we have discussed various branches of psychology, but these are not limit to. There are more branches which are young psychology, young branches, For example, forensic psychology, sports psychology, environmental psychology. Forensic psychology, which basically applies psychology in crime and law. Sports psychology, which help athletes to improve performance. Environmental psychology, which study how environment affect behavior, like how hospital design can reduce the stress. Though not directly linked to nursing, these fields shows how psychology continue to grow and diversify. Now, you may be wondering, why should nursing students know about all these branches? So, the answer is very simple. Nursing is not just about giving medicine, it's about understanding the whole person. Developmental psychology help in pediatric and geriatric care. Clinical and counseling psychology help in patients' emotions, treating handling patients' emotions. Social psychology help in community health nursing. Health psychology help in promoting wellness and preventing diseases. So every branch of psychology has something valuable for nursing practice. To- So as a nursing professional, having knowledge of these branches will make us more empathetic, more effective, and more scientific in patients' care. In the next video, we will discuss another important topic on psychology. So, happy learning!